The fifth child has tested positive for monkeypox in the United States, marking the second pediatric case in California. The news comes as the FDA tells ABC News numerous children have been given special permission to get the monkeypox vaccine, normally only available to adults. I want to bring in Dr. Alok Patel from Stanford Children's Health and Wizdom Powell, Chief Social Impact and Diversity Officer at Headspace Health, for more on this. Dr. Patel, what can you tell us about these pediatric cases, and how worried should parents be right now?
Well, Diane, good morning. And to address the latter comment, because I know a lot of parents are watching, there is no need for parents to panic. Awareness is key, and paying attention to any close contacts who may have symptoms or who may have tested positive for monkeypox. Now, fortunately, what we know so far is these 5 kids who have monkeypox are doing well, including one report that one recovered in Long Island. There are no hospitalizations or severe illness reported right now. Parents out there just need to be aware. Remember, hand washing is key, just like we've been talking about since the beginning of any conversation about infectious disease, and making sure that parents are aware of any close contacts out there and just staying put to learn more. And as you mentioned, the JYNNEOS vaccine is being given to kids on a case-by-case basis, but there is no plan or even need for a mass vaccination campaign for kids right now.
Now, Wizdom, we are still in a COVID pandemic. Kids are heading back to school. So how do parents handle the stress of just these added concerns now on top of everything else, especially after the last 2 years?
These are great questions, Diane, because as you are well aware, we are now in a period where we're actually experiencing a syndemic, and that's the overlapping of 2 emerging public health crises at one time. And I think that we all know that those kinds of incidents can produce a sense of psychological uncertainty in everyone. So fears and worries and concerns are likely to arise, especially in children. I think it's important, first of all, to allay those concerns with real factual information. There's a lot of information out there, a lot of noise, and it can be difficult for parents and young people to sift through what is true and what is not. The most important thing we can do right now is help our children to grapple with that information and to get the facts straight. First of all, we know that COVID-19 and monkeypox are not the same thing. COVID-19 can be fatal. Monkeypox at this stage, as we know it, cannot. And there are a lot of things that we have in our arsenal to control this virus in ways that we didn't have for COVID-19. So the first thing we have to do is help our children to settle themselves, catch their breath, help them to sort through what is fact and fiction, and more importantly, help to assure them that parents are here to support them, even as they express worry and concern.
Now, Dr. Patel, monkeypox vaccines, as you said, they exist, but usually only for adults, and not just anyone can get one. How does that process work, and what else can we do to protect ourselves and our kids?
Well, the process is kind of vague right now in terms of how much more supply we can get. You know, Diane, it comes down to having part of the ability to manufacture vaccines, but not the rest of the supply. So that is definitely something that could be improved regarding mobilization and creating more vaccines as these states declare emergencies and get more federal funding. One thing that we want to pay attention to is to make sure that the vaccines are given preferentially to high-risk communities so we can control the spread. The one thing that we don't want to see happen is the U.S. start to care once children, pregnant women, or immunocompromised individuals are affected, and ignore the fact of the group right now where 99% of cases are. We want to avoid the stigma while balancing targeted vaccine and resource allocation. And regarding what parents can do to keep their kids safe, we mentioned things like making sure kids are washing their hands and practicing that routine hygiene. That is extremely important. But also anyone out there should not go into over panic mode and not think that this has the transmissibility of COVID-19. It doesn't. And as we just mentioned right now, we do have vaccines available. We have treatments, and this virus has been around for decades. So there shouldn't be any huge surprises aside from the fact that the virus has jumped from Africa and is now endemic in other, well, it's not endemic yet, but it's now spreading in other countries.
So, Wizdom, we have sort of just learned to live with COVID-19. People are going out to eat at restaurants again. They're working out in gyms. The majority of mask mandates have dropped. So what's your advice for anyone who just feels exhausted at the thought of any more precautions and any more worries at this point?
Well, the first thing we have to do is just accept the fact that we all are experiencing pandemic fatigue, and to normalize that, and to just give ourselves radical permission to feel tired and exhausted by it all. And the second thing we can do is to recognize when we're getting into trouble with our fear and worry, and discerning when it is important for us to seek help and support. It's important for us to stay steady and to recognize that this too shall pass, and that the most thing we can do, the best thing we can do right now is to be calm and stay steady and to support each other through this very difficult and challenging and uncertain time.
All right, Dr. Alok Patel, Wizdom Powell, we appreciate it. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.